Hello, my name is Manesh Patel. I'm a cardiologist and the chief of cardiology at Duke University, and I'm here to discuss the ACST-2 trial, the asymptomatic carotid trial, presented today at the European Society of Cardiology and published simultaneously in Lancet. This is an important addition to how we care for our patients with asymptomatic carotid artery stenosis period. Importantly, it's worth thinking about the fact that symptomatic carotid artery stenosis we know needs to get revascularization, often carotid artery endarterectomy or surgical revascularization. However, for those patients that have asymptomatic carotid artery stenosis, there is controversy of really three options for those patients. Should they get revascularization, either with stenting or surgery, or should they get medical therapy? We know from several data sources that optimal medical therapy leads to about a rate of 1% of stroke, either disabling or non-disabling stroke. And in this study, they randomized patients who had a 60% stenosis over 3,000, the largest carotid artery stenting versus surgery trial performed to date. They randomly assigned those patients with at least 60% stenosis who were asymptomatic, no previous stroke or symptoms in the last year or so, to either surgery or stenting. And they looked at both the 30-day rate of stroke and death and the 5-year rate of all strokes. And importantly, they found that the rates were similar at 30 days between stenting and surgery, and they found a similar rate at 5 years. What I found to be most interesting is that the rates were similar at 30 days. There was a description in the presentation in the publication that non-disabling stroke with a modified ranking score of 0 to 2 was different with stenting versus surgery at 30 days in all events. However, at 5 years, all stroke between the two groups was similar. And when they did a meta-analysis of all stenting and surgery studies, including both the asymptomatic and the symptomatic, again, stenting and surgery seemed to have similar events for both stroke and death. However, I think the critical question still is, do our asymptomatic patients need revascularization at all? When we look in the follow-up of the study, at 1 month, there was about a 1% rate of disabling stroke or death, and during follow-up, it was about 0.5% at 5 years. It's important to recognize that if you're a patient who has asymptomatic carotid artery stenosis and your medical therapy, optimal medical therapy rate is 1% per year, taking that first 30-day 1% risk is something we're still looking to better understand who should get that. Hopefully the ongoing CREST-2 trial, which will have a randomized asymptomatic arm of medical therapy versus randomizing asymptomatic patients to revascularization, will help answer this critical question.